All right, good afternoon, everyone. Thank you so much for joining us. My name is John Fritz. I'm the wellness program manager here at the Heart of the Rockies Regional Medical Center in Salida. Today we've got a discussion on the current status of COVID-19 in our community, as well as a lot of steps that you can take to improve your health. And we've got a great team put together. We've got Andrea Karlstrom, who is the executive director of Chaffey County Public Health and the Incident Command for the COVID crisis. We also have Dr. Erica Gelligan, who is the hospital incident command hospitalist, as well as infection control. And she's going to be speaking as well today. And then we have Sam Vandeveld, myself, and Savannah from the Wellness U team. And it's going to be great. So kicking things off, before we start in with Andrea's updates, I want to just give you a quick piece of why we're doing this discussion today. There's been a lot of great talk about how to prevent the spread of the coronavirus, and there's also a lot you can do to make yourself healthier. So we want to talk about that today. As far as if you have questions, we really want to answer questions. If you're with us on Zoom, you can use the chat feature on Zoom. If you're following us on YouTube Live, you can also use the chat feature. For those of you that are on Facebook, use the chat feature, but we're not going to be able to answer those questions today live, but we will definitely get back to you. So please ask your questions and maybe say who you're asking the question to. So whether it's Andrea, Dr. Galligan, John Fritz, or Sam or Savannah. So with that, Andrea, do you want to give us a little update on some of your findings?
Yeah, you bet. Thank you, John, and thank you, Heart of the Rockies Regional Medical Center, for the invitation. I am hearing that perhaps on Facebook Live, people are not necessarily hearing us, so we will do our best to project. It is very possible that maybe our face coverings are also kind of clouding our voice, but we'll try to do our best. And again, this will be on Zoom and on YouTube, and we'll do our best to provide the recording with some volume on Facebook in the future. So as of yesterday, the Chaffey County COVID-19 case count has remained steady if you look at cases that are not related to Columbine Manor or the Buena Vista Correctional Complex. So where we're sitting as of yesterday afternoon is at 227 positive cases, and of those, 34 have been attributed to community members not associated with either a long-term care outbreak or our Department of Corrections outbreak. Many of you have wanted to know how many out-of-county cases we have tested, and so that is included at the bottom of the slide. That's 15. So let's go ahead and give you a few seconds to do some data download. We've also heard from our community that we want more information regarding data. So hopefully as early as next week, we're going to be launching a data dashboard that will give you the information that you're looking for. So stay tuned for that. And you can see where we're at. I'm not expecting all of you to be able to read this, but you can see that we really held steady for a while, and we are starting to see an increase of cases. No surprise. What feels like many moons ago, but several months ago, as we started lifting restrictions in our county on Facebook Live and at our town halls, we did say that we would anticipate an increase in cases. It's because of all of your hard work, though, that our caseload has really maintained a stable environment. So just a COVID-19 101, just in case you've been living under a rock, or perhaps you have been, I don't know, at your winter, summer, spring cabin for a while and haven't had access to the media. What we're talking about is a novel virus, so a brand new virus. We've never seen one like it before, that spreads mainly from person to person. It spreads between people who are in close contact with one another. And when we say close contact, we're referring to being within 6 feet of someone for more than 15 minutes. And that definition has waffled a little bit between 10 and 30 minutes, but we're choosing the 15-minute duration. It's transmitted through respiratory droplets. And they're produced when an infection person coughs, sneezes, or even talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Recent studies do suggest that COVID-19 may spread by people who are not showing any symptoms at all. And again, we refer to this population as asymptomatic. And we've seen that anywhere between 30 to 50% of our cases are actually asymptomatic. Again, an attribute to a novel virus. In Chaffee County, we are committed to the 5 commitments to containment. And these include maintaining 6 feet of physical distance. The more distance, the better. However, we are using the 6 feet rule right now. We really want everyone to wash your hands often. Properly wear your face covering in public, and I'll go into all of these in more detail. Get tested if you have symptoms, or if you know that you've come into close contact with someone who is tested positive. And please stay home when you're sick. So let's talk a little bit about distancing. So when you're inside your home, avoid close contact with people who are sick. If possible, maintain that 6-foot distance with those who are sick or other household members who may become symptomatic. That seems easy, right? However, outside of your home, that's another story. Putting 6 feet of distance between yourself and others who don't live in your household is really crucial at this time. Remember that some people without symptoms can transmit the virus, even if you have no idea that they may have come into contact with someone with the virus. So again, that 6-foot distance or 2 arms length is really important. We can't stress that enough. And it is especially important for those who are more vulnerable or who are at higher risk of getting the virus to maintain that distance. And for us to respect others by maintaining that distance as well. Washing those hands. If you didn't do it before regularly, I hope you're doing it now. Washing your hands frequently for at least 20 seconds. And I know that many people have come up with songs or strategies to count out those 20 seconds, making sure that you get a good lather of soap. If water and soap are not available, use hand sanitizer with at least 60% alcohol. Cover all surfaces of your hands, fingernails, lower arms. Rub them together until they feel dry. So everyone's favorite, right? Please wear a mask. So whether you like it or not, wearing a mask is a public health strategy to prevent the spread of this virus. So covering your mouth and nose with a cloth face covering when around others, or when you anticipate that you may come into contact with others. Again, you could transmit the virus without being sick or symptomatic. So this is really important. Meant to protect others, not necessarily yourself, although some of the research that's coming out may indicate that that's the case. And so again, wearing a mask, face cloth, covering, it can be a bandana. People are using all sorts of different coverings so that they don't transmit the virus to others. Please do not use a face mask that's meant for our medical community and first responders. Those items are really important for us to conduct a proper response to this virus and keep our first responders and healthcare workers safe. The mask is not a replacement for distancing. So all of these strategies work together and complement each other for maximum prevention of the spread of the virus. So we are, if you didn't already know, in a statewide mask mandate. Mask wearing is mandatory in public indoor spaces, which includes public or privately owned, managed or operated, enclosed indoor areas that are accessible to the public. It can be a place of employment, or it can be a place where you provide services. It does not mean someone's residence, including a room at a motel or hotel, or a residential room for students at an educational facility. It is not required to wear a mask outdoors, but it is highly urged. And we want to take a sensible and practical approach here. We've been saying this for weeks and weeks. If you are out running by yourself, you probably wouldn't wear a mask. However, keep a mask handy because you never know when you need them into your friends on the trail. And some examples of public indoor spaces include, but are not limited to, and you can see a long list there. We have had a lot of folks reach out to our department wanting to know if their space is included in indoor spaces. We really think the governor and Colorado Department of Public Health and Environment did an amazing job this time around of being very clear of what is expected of us. You can learn more about the mask mandate on the state health department's website. You can also find it on the COVID-19 Chaffee County Facebook page, and you can learn more about it in our situational awareness reports that we're posting on both Facebook and on the county website. Getting tested. It's an important strategy for us to learn more about the epidemiological attributes of this virus, but also to protect those in our community from the virus. Chaffee County Public Health is offering free testing site visits on Tuesdays and Thursdays from 9:30 until noon, or until you have appointments. By appointment only, please call our department at 539-4510. If nobody answers, please leave a message and someone will get back to you right away. There are multiple testing options throughout the county and certainly beyond, and so public health is not the only place where you can get tested. And we're ramping up testing what feels like on a weekly basis. So it's important for our community to know that there are plentiful options to get tested. The drawback right now that we're facing is that we're seeing an 8 to 10 day delay in results. Huge shortcoming. It's extremely disappointing. We understand it's beyond our control here in this county, but we are working with the hospital and other healthcare providers to explore what it would take to build greater capacity locally so that we can get results to our community members faster, and that would expedite the contact tracing protocol. Criteria for testing for Chaffee County Public Health is pretty much everyone. So certainly we want to test anyone who's showing signs and symptoms of the virus, any asymptomatic patient who has had a known contact with someone who is tested positive, and all healthcare workers, first responders, senior care facility workers, and other critical workers in our community, whether they have symptoms or not. If you're sick, please stay home. So in the past, pre-pandemic, if you had a cough or if you had a mild fever, you may contemplate staying home or going to work. Well, in COVID-19 days, we really need to be mindful that we're monitoring our health on a daily basis. If we show any of these symptoms listed here, we must stay home. That list continues to grow, And what we're finding is that at the beginning of this pandemic, the top symptoms were fever, shortness of breath, and cough. However, what we're really seeing are some interesting trends on new loss of taste or smell, and also vomiting, diarrhea, kind of GI symptoms. So it is interesting to track and trend these. Take your temperature. So if your symptoms develop and you have a temperature, it is important to stay home and to follow all of the guidelines that we have on isolation and quarantine. This is a huge shift in our society and in our community, but together we certainly can be supportive and really create a culture that we support people staying home when they're sick or when their children are sick. Three main goals in our approach to maintaining COVID-19. We must acquire more personal protective equipment. These include, as I'm sure many of you are aware, masks, gloves, gowns, face shields, and testing equipment. We want to, again, expand our testing, our tracking, and our tracing capacity. And the good news is that Chaffee County Public Health just hired 2 new contact tracers. They start next week, and that will certainly provide some respite to my amazing team and myself, who've been really working 24/7 since the beginning of this event to ensure that our community has the information that it needs to prevent the spread of the virus. We also want to ensure that our hospitals and healthcare community have the capacity to meet the need if we do see a hospital surge or just a surge in general in our community. So, final thoughts. We've never done this before. So while public health and the hospital and many of our partners have trained and have participated in exercises related to pandemics and communicable disease outbreaks, this is a novel virus without a vaccine, and we're writing the playbook as we go. So we really appreciate everyone's patience and thoughtfulness as we navigate a situation that really no one in our society has ever been through. Pandemics are exhausting, I'm not going to lie. They are stressful, they're scary, they're challenging. We have heard from many of you on your thoughts about how we're handling the virus locally, how we're handling it as a state, and of course, as a nation. We don't have all the answers. However, we here in Chaffee County have strong relationships. We have history together, and we are all in this as a system, a public health system, to protect all of you. In addition to that, we've been tasked with a tremendous amount of personal responsibility and accountability for all of us to do our best in looking at the 5 commitments and following them to the best of our ability. We're also human, and we are social beings by nature. The weather is nice out, we've had a lot of holidays that have happened in between now and the beginning of mid-March, and so we need to just be monitoring what risks we as a community are willing to take in the fight against COVID-19. However, what keeps me going every day is knowing that here in Chaffee County, we have a special community. We are strong, we are resilient, we are caring, and truly we are in this together. This is a marathon, ultra marathon of ultra marathons. It's not a sprint. However, we will get through this, and we will be a stronger community for it. So thank you so much, Chaffee County, for being the amazing community that you are. Your dedication, your commitment, and your support are what has really gotten us to a stable environment here in the county. And with that, I'll turn it over to Dr. Galvan.
Thank you, Andrea. Always a pleasure to work with Katy County Public Health as we have done so through this crisis. I certainly appreciate that and wellness for letting me participate in this unique angle to healthcare fighting disease that I haven't really thought of in the past. But it's a huge attribute. It's something that we can do ourselves. So my name is Erica Galvan. I am the Medical Director for Infection Prevention and Control here at Carter Rockies. I just wanted to touch base on a few things. First of all, Andrea has already talked about the Colorado case count. As you know, KP County, or Colorado, has about 40,000 cases of COVID-19 that have been diagnosed since the early or late February. And if you see here, we began reopening on April 27th. Here is what I call S'more Day, which is July 4th, where everybody comes to Chaffee County to go camp and buy up all the graham crackers in our county so they can go make s'mores. And look what happens to S'more Day. The numbers have increased dramatically in our state. And I think that's because there's more collaboration with other people and community coming together and having s'mores, I suppose. Although we are fortunate, this is the 40,000 for the whole state of Colorado since this crisis began. In the United States, we have over 70,000 new cases a day with 1,000 deaths a day, which is striking. Which brings me to what's happening in our hospitals in our state. And what we think about is that 90% of the hospitals have been reporting their data. We're actually doing okay. We have approximately 400 patients in the hospital across the Colorado with either known COVID-19 or presumed COVID-19. We have about 300 patients on ventilators with about 1,000 or 1,100 ventilators available. So we're doing okay. And I think that helps us with trying to keep everybody safe and out of the hospital, which is my goal. And I know everybody else's goal here. With the deaths in the state of Colorado, we've had 1,600 deaths for the state. If you look over here, you can see as you age, the number of deaths increase dramatically. Our highest population is greater than 65 years of age. These patients in this elderly group tend to have comorbidities like hypertension, diabetes, obesity, and are more at risk for getting sick from diseases, not just COVID-19, but other diseases. And it's important to recognize that there are ways that those can be prevented. 4,000 deaths since the beginning of the year in the state, not due to COVID-19, not all of them due to COVID-19, but most of them are due to respiratory diseases, circulatory diseases, diabetes, renal failure, and obesity makes the list as well. Here's what the CDC classifies as established risk factors for COVID-19. And this is for developing severe COVID-19. And that is chronic kidney disease, chronic obstructive pulmonary disease or emphysema, obesity with a BMI of greater than 30, or body mass index greater than 30, serious cardiovascular diseases, and this encompasses heart failure, coronary artery disease, and other dilated cardiomyopathies, which are enlarged hearts. And type 2 diabetes makes the established risk category. Here's some possible risk factors. These are seen that can be correlated with severe COVID-19, and they're asthma, cerebrovascular diseases, as in stroke, hypertension or high blood pressure, dementia, which is interesting. A lot of dementia comes from cerebrovascular disease. And so it kind of ties in. And you want to tie in smoking. Smoking also exacerbates all of the above established or possible risk factors. So these are, the ones I highlighted in red, are the ones that are modifiable, something that you can do something about. So what can you do to prevent getting COVID-19? Andrea did a great job at explaining, and I know you've heard it time and time again. Wash your hands, wear a mask, maintain physical distancing. The other thing that we don't hear so much about is to reduce the comorbidities associated with worse outcomes. And not just for the disease, not just for COVID-19, but for all disease processes. So what are the effects of comorbidities? What do they have on the inflammatory process? Studies indicate that obese individuals are more likely to develop infections. They store the pathogens in the adipose tissue, and it acts as a reservoir. Diabetics have a higher inflammatory process related to their constant increase in their glucose levels, and it upregulates some receptors. Hypertensive individuals are also at increased risk. Studies have shown that those individuals with these conditions that are affected by COVID-19 present an uncontrolled release of pro-inflammatory cytokines and an imbalance to the immune response, leading to a cytokine storm phenomenon. So you ask, well, what are cytokines? Cytokines are proteins that are released by our white blood cells when an infection is present. And the role of cytokines are to attack an infection. And the cells that are involved in the body's immune response need to communicate with each other. And they send out all these little armies in your body to notify everybody that there's a violator in the house. But what happens when you have a storm or too much of a good thing? Then you have things bad. So you have a cytokine storm affects your blood levels, your clotting factors, your body goes into shock, you can have lung injury, you have cell death. It also paralyzes your immune system, and you can have renal failure. All of those things wind up with inflammation, organ failure, and infection, and ultimately death. And so the important thing to do here is how to prevent a cytokine storm, how to increase your immune system so that you don't have to get there, and avoid becoming critically ill because of obesity, or diabetes, hypertension. All those play a role here in trying to prevent disease and progression of disease and the cytokine storm. At least the ability for the body to be able to handle it better. That is all I have to say. I'd be happy to answer questions afterwards. And here's John to tell you how you can make all this better.
Yes. Dr. Guggen, thank you. That is fantastic information. I think, what we're going to spend the rest of the time on is talking about that inflammation and immune system interaction. And it's very important for everyone to know that we don't want anyone to get COVID-19. We don't want it. None of us want it. It may happen to us, right? I mean, it's really growing throughout our country. What we want to spend the rest of the time on today is how do you build up your defenses so that you can lessen the burden or what might happen to you if you do get COVID-19. And there is, in fact, a lot you can do. Preventing, stay at home, those are great things. But if you do get it, there is a lot you can do to boost your immune system, to make you healthier, and it's a great way to also stay out of the hospital. So I want to introduce our next speaker real quick. I got one slide here on hospitalizations. We don't want to die. We also don't want to be hospitalized and overburden the healthcare system. And one of the best ways is to get yourself as healthy as possible. All right. So just to highlight the risk factors associated with hospitalization, you can see obesity, hypertension, diabetes. These are all things that we have some sort of control over, and we want to really dive into those the rest of our time today. So who we have next is Sam Van Velden, an exercise physiologist with a master's degree. He's also the adjunct professor at CMC for biology and nutrition. He's an excellent speaker, and he's got some awesome information about physical activity and the astonishing effects it has on your body. Sam, come on up.
Hello, thank you for having us today. So I'm going to talk about kind of exercise and immunology and what we can kind of do on the individual level to prevent the aspect of coronavirus and the severity. So I'm a huge history nerd, so I'm always going to start with a little historical perspective of exercise immunology. It's very interesting, you know, it's a new area of study and it's really developed kind of during the AIDS epidemic and HIV that we've had. That was a very, very scary time, but a lot of research came out of that. Specifically today, I'm going to talk about immune system of T helper cells and B cells. Again, that was a really scary time that we really leaned on science to get us out of it, and likely we will have to lean on science again to get us out of this one. So our immune system is responsible for recognizing self-material versus non-self-material, and identifying, detecting, and destroying pathogens in foreign bodies. So specifically the coronavirus and most viruses that we've seen, the way that the virus works is it comes into our body and hijacks our own cells. So they take control of those cells and then they replicate as fast as they can. So our immune system is responsible for setting up beacons to recognize these hijacked cells. So the quicker we can respond to these hijacked cells, the less severity the disease may implement you on the individual. It's also responsible, the immune system is to damage old cells. So when your body's really stressed, you have emotional stress, physical stress, lack of nutrition, your body, your immune system is responsible for repairing those cells. So it gives you a little insight to what we'll talk about today. If we are having a very stressful lifestyle, our immune system's working to repair that lifestyle. So that way, if you contract coronavirus, we have a less likely chance to detect that and severity and replicate. So there's two different kinds of immune responses. We have innate and adaptive. So the innate response is very much you contract coronavirus and we send that beacon out and detect, destroy, and engulf like a Pac-Man on the coronavirus. Now, more of our adaptive is also important as we make the memory of that virus and then form antibodies. Again, don't want to go down that rabbit hole as we're still learning about antibodies currently. Okay, so how does exercise play into this? So we know that the immune cells, T cells, neutrophils, etc., live within our lymph nodes that are spread all over the body and our spleen. But at rest, where I'm sitting right now, our immune cells are in the blood about 1 to 2% circulating, circumnavigating the body for any viruses, foreign pathogens, etc. But with exercise, that has been upregulated 50 to 60%. So those immune cells are taken from the lymph nodes, from your spleen, into the blood. So that's quite great, because then when you're done exercising, then it's going to go into the tissues to then maybe establish, oh, there's a foreign body here, there's a virus here, bacteria here. So very important, our bodies are really designed to move. You know, we're not meant to be sitting. It's like a car. You know, you buy a car off the lot, you're not going to put it in the garage for years. You need to drive it or else it's not going to work. Well, same with the immune system. You need to move to circumnavigate our immune cells. So the application of this in terms of coronavirus currently, again, you know that our T cells, our B cells are upregulated 50 to 60% when we move. That maintains for 3 to 4 hours after moderate exercise. So I go on a 30-minute brisk walk, 45-minute brisk walk. My immune system is upregulated then within my body 50 to 60% for up to 3 to 4 hours. So if I'm going to go to the grocery store or a business meeting, or heaven forbid an airplane, then I'm going to exercise 30 to 40 minutes before I encounter that public space. If I then contract coronavirus, then my body's upregulated those immune cells so they can detect and destroy and send those beacons to a coronavirus. We've all heard that it's important about the contagion time, how often you're exposed, how long you're exposed to the virus. Well, it makes me think, if our immune system's detecting the virus quicker, is that then lowering the contagion time that we're exposed to the virus? We also know that people who are less symptomatic are less likely to spread the disease. Although they still can, they're less likely. So if we exercise often, would you maybe less likely to have symptoms? Would we then be less likely to then spread the disease to my coworkers, to my parents, to the mailman, etc.? Okay, some interesting research to kind of back some of the claims that I'm making here. Big epidemiology study looking at sedentary people. Sedentary behavior is majority of the time seated. You know, you're still active, you're moving around, but you're not exercising 30 minutes a day, 5 days a week. They took those individuals and exercised them 45 minutes at a moderate exercise for 5 days a week versus a control that maintained their sedentary lifestyle. So the individuals that exercised 45 minutes, 5 days a week, had a 45% reduction in illness in a 12 to 15 week period versus the control. So that really supports this idea that we should have exercises kind of like having a house cleaner. Our bodies are our house, and the coronavirus is our house guest. Comes in, dirties the place up. If you exercise 30, 40 minutes, we're having that cleaner come in 30 to 45 minutes a day to circumnavigate the house. And that's supported with this study. However, just like water's a great thing, but you can still drown in it. So exercise to an excess also could be eliciting a big stress to the body and compromise our immune system. So another study looked at LA marathon racers, and the individuals that did the race versus the individuals that did not do the race, they had a 5.9 times greater chance of getting sick. And if they exercised 60 miles, if they ran 60 miles a week, they had a double the chance of getting sick before the race. So what does that tell you? It tells you that any effort of half marathon or longer is actually a big stressor to the body. So our immune system is going to then respond to repair nutrients, repair damaged muscle glycogen stores. So your immune system is busy doing other things. And then coronavirus or bacteria, any kind of other illness comes in, and we have less soldiers to address that virus, bacteria, or illness. So I'm kind of glad that, you know, around the country right now, we're canceling marathon races, ultra endurance cycling races, not just because it's a bunch of people gathering, because that's such a stressor to the human body that then those individuals are just as compromised as people with coronavirus. They become people of concern for our country, and then can spread the virus farther. So, you know, I also get a lot of questions about high intensity interval training, and that's also a high stressor. Right now, we need to work on our wellness, not our elite fitness. So, you know, exercise in moderation. Some people are like, yes, I don't have to exercise like crazy. Others, yeah. Okay, so that's going to transition into now who is most at risk. So individuals who happen to die from coronavirus, 32% of them had heart disease, 30% had diabetes, and 18% are chronic lung disease. That's 80% with comorbidities. So coronavirus is a very scary disease. It's novel, but a big issue is how many people are living with comorbidities in our country. And so a lot of these are lifestyle diseases, things we have very much control over. You know, people who have comorbidities have 45% chance of getting to the hospital if they contract coronavirus. Individuals who don't have comorbidities have an 8% chance of ending up in the hospital. Pretty profound numbers. So this chart here looks at cardiorespiratory fitness. So they took 52,000 people and looked at what is the most attributing factor to all-cause mortality. And they found that it's actually low cardiorespiratory fitness. So your aerobic fitness, your actual fitness level of your heart, how much oxygen your heart can utilize, So if you smoke, you're obese, and you have diabetes, but you're not in the lowest quartile of cardiovascular fitness, you're less likely to die than someone who's in the lowest quartile of cardiovascular fitness. So basically it's saying individuals who do not participate in physical inactivity and cannot exercise at high levels or walk faster than 3 miles per hour, they are the highest at risk for all-cause mortality and then coronavirus. So what we can do about that is improving our cardiorespiratory fitness with walking, swimming, biking, with maintaining the same regulations that Andrew just talked about. So exercise is medicine. Exercise lowers the blood pressure. If we go back to hypertension, doing aerobic exercise, that'll lower your blood pressure after the bout of exercise. If you look at hypertension, the best thing you can do is exercise. Diabetes uptakes blood sugar. Best thing you can do is aerobic exercise. High cholesterol, exercise uptakes LDL cholesterol. Best thing you can do. So in terms of coronavirus, you do anything acutely enough, exercise can improve your actual immune system and help build a stronger immune system, protect yourself against COVID-19, but also your neighbors from spreading it farther and farther. And so my coworker Savannah will come in and talk about other aspects of lifestyle, and what you'll see as a common theme is a stressor to the body. So we talked about too much exercise. Now we're going to talk about too much stress or poor diet, and how those all can lead to inflammation in the body, and our immune system is now putting out all of those fires. So if you contract coronavirus, it has less soldiers to address that virus, hijacking more cells, replicating over and over and over again. So with that, here comes Savannah.
Hello everyone, my name is Savannah and I'm a health promotion specialist here with Farther Rockies Wellness Youth Program. And as Sam introduced me, I'm going to talk about a very literally heavy topic that we are all feeling, and that's stress in the immune health. We all have stress, and right now we are in a bigger stressful time than we've ever experienced. But I want to set the stage right away. Stress isn't something that happens to us. It is something that happens in us. So we perceive the stress. And that's going to be kind of the theme as we move along. So let's go ahead and get into stress. So what is stress? We all know stress is a normal reaction that the body has when changes occur. Our bodies respond to these changes physically, mentally, or emotionally. And let's be honest, stress is a part of life. You have stress when you wake up in the morning, whether maybe a coworker made you mad or something, but we experience stress every single day. And this is like a great way to look at it. What stresses me out is not what's going to stress you out. Watching the news can be very stressful. Eating a hot dog, that creates stress on our body. Money issues, marital issues, smoking. There's so many different stressors, and so what stresses you is going to look way different than what stresses me. And stress and health. So our body is designed to experience stress and react to it. So like Sam talked about, exercise is actually really good stress. So when we have too much of it, it is not good. It creates inflammation. Stress can help us keep positive, alert, and motivated and ready to fight. And really, our stress response is supposed to be super acute. So it's that fight or flight response. So we're going to kind of get right into our acute stress system. So again, this evolved as a survival mechanism. It's enabling us as individuals and other mammals to react quickly to life-threatening situations. When we are under this acute stress response, the body goes through hormonal changes, and then we also know experience physiological responses to fight that threat off or flee to safety. So your heart rate starting to pump, those eyes dilate, start to dilate, and you're getting ready to respond to whatever stressor you're about to experience. And so we're going to kind of walk through it. And then whenever I think of this like acute stress response, I always picture being run after a tiger, or in this case, a dinosaur. So let's walk through it. So you're being chased by a dinosaur. You perceive this as a stress. Remember that. You perceive being chased by a dinosaur as a stressor. From there, an alarm is sounded in the brain saying, oh my gosh, I'm being chased by a dinosaur right now. So our sympathetic nervous system then starts to get activated. So epinephrine, which is otherwise known as adrenaline, is pumped into the bloodstream, which increases our heart rate and blood pressure. So that's gonna get us maybe like into that running stance of like, I'm gonna outrun this dinosaur right now, like let's go. And then epinephrine also triggers the release of blood sugar, which is glucose, and fat from the body to supply the energy to the body. So that's gonna give us energy to keep on going. You always hear about these weird spurts of people like lifting humans or lifting cars off of humans, and that's that quick release. Like your body put all its energy into fighting off that stressor. And as this stressor goes on, so you're in this marathon of this dinosaur coming after you, and you are still running. Your body's gonna press a gas pedal, and it's gonna say, let's keep going. And that's where our second component of our stress response comes in, and that's our HPA axis. This can get super sciencey, but I'm going to try and break it down. So our HPA axis deals with our hormones, and so it's going to activate and release cortisol. So the body is going to stay revved up and on high alert until this threat passes. Once the threat passes, the parasympathetic nervous system puts the brake on it, and it says, okay, the stress response is off, I can kind of go back and bring it down. A problem with this, though, is that with coronavirus, right now, we have this weird amount of stress that we maybe don't necessarily recognize that it's there, but we wake up every single morning, we watch the news, it's on the news, you go to work, you're wearing a mask, it's there always, and this creates chronic stress. So again, our body's stress response is usually self-limiting. Once the perceived threat has passed, our hormone levels return to normal. With chronic stress though, like think of an egg, we're just like on that verge of breaking every single day. So that stressor is always there. And why is this a bad thing? Well, for many reasons, like our immune function. So when stress becomes chronic, our health and well-being kind of go out the door. Our body's only goal is to handle that stressor. So how that works then is through our hormones. So we have like it's gonna get a little science for this, hold with me, but we have cholesterol floating around our bloodstream, and it goes cholesterol, pregnenolone, and then from there, DHEA. And so then it decides where is all my energy supplies going to go to. If you're always in stress, it's just gonna say cortisol, 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 and everything else gets thrown off. When you're in a very stressful event, your immune system just shuts off. It's like, it's not important right now. I'm really just trying to fight that stressor. And in the long term, this creates a lot of inflammation in our body. Like Sam talked about, inflammation is like a good thing with exercise, but over the long term, too much of a good thing is generally always a bad thing. Even when we talk about health, like if you just ate kale every single day, you are not going to be feeling great. It's just too much. So that's why chronic stress and immune function is extremely, extremely important. And we can kind of look at it this way. So the first graph I have right here is the high stress, low stress. So we're being chased by a dinosaur or a tiger. Our stress response comes up. That stress is no longer perceived. It drops down. With COVID-19 right now, we have this chronic stress. So we're right in that middle of that low stress and high stress. So our body is just so overwhelmed with the stressor, it never can kind of catch up or drop back down. And on top of that, life keeps going on, right? Coronavirus is still going. I mean, I feel like I'm not the only one when I wake up and I'm like, okay, I'm almost like wishing summer away or wishing days away because I'm like, well, it's going to be done. Well, we don't know when it's going to be done, so we need to learn to flow with it. And what happens is, you wake up late, so you chronic stress right there from COVID, and then you wake up late for work. That creates that stress response in our body. So we just added another stressor. And then you started thinking about that fight you had with your spouse or your friend last night, and that's what you perceived as a stress. And so another stress response goes up. Then it drops back down to that chronic state again. Then you watch the news when you got home. I mean, the news right now is not positive. It's extremely, extremely stressful to watch. We have that another hit in our stress response. And then last but not least, you ate a bowl of ice cream right before bed. We've all been there, it's A-okay, but that actually does create a stress response in your body. And we'll talk about that here in a little bit with food. But as you can see, we're already at this chronic level of stress that we need to learn to kind of flow with, because life is moving on and life is very stressful as well. So, what can we do about it? You've all been told stress management, right? It seems like such an easy thing, but unfortunately it is not. One way to think of it is that stressful events and stressors are always going to be there in our life. But if we can learn to identify what stresses us and how we can take care of ourselves physically and emotionally during these high periods of stress, or these extremely long ultra marathons of stress, we'll be able to handle these short-term stressors and these long-term stressors more successfully. So what can we do? One, we'll talk about this more, but eating like a healthy and balanced diet. This is not the time to be stuck at home eating ice cream and chips and cookies and all this comfort food. Even if it makes us feel good, it is severely dropping our immune system. I can't say it enough, and we'll talk about it here more in a couple of minutes. Exercising regularly. So like Sam said, that does not mean going out and running a marathon every single day. But maybe you're going for a morning walk for 30 minutes, you're going for an evening walk for 30 minutes, and you're doing a little bit of strength training. It doesn't have to be this huge event. Sleep. Sleep is so underrated, and John's going to talk about sleep here in a second, but making sure we get high quality and quantity sleep is so important. Relaxation techniques. Yoga, deep breathing, massage, meditation are all great ways. Participating in hobbies. Nothing makes me feel better than going for a bike ride. I feel so relaxed when I get home from it. Fostering healthy relationships. One thing I think we can all agree is we already have social beings. We want that social connectedness. So is that, like if you're on your bike ride and someone's coming past you, give them a hi. That's a nice way to like foster a healthy relationship with someone and still stay connected in our community. Call your friends and families. Sense of humor. Life is hard, but if we can have a sense of humor through it, it can make it a little bit easier. Volunteering is a great way. As always, seeking professional help when needed. Journaling. There's a really cool study that looked at journaling with arthritis, and they saw that people who journaled for 20 minutes a day, they called it rampage journaling, where you just literally wrote all your thoughts down, all your stressors, 20 minutes every single day for a period of time. It actually reduced their inflammation levels, which is generally looked at by your C-reactive protein, over time. So journaling is a great way to get your thoughts out there. And then gratitude. Going to work every single day is maybe not the funnest thing, but what helps with me is I'll ride my bike and I look around and like, man, I'm so grateful that like I can ride my bike to work, that I can look up at Mount Chavano as I'm biking to work, but just being grateful every single day. And then, as always, there's times where we just can't handle on our own. Reach out to people, Solvista, NAMI, Chaffee County, and then another great website is Chaffee Resources. Like, reach out when you need it. We have people here for you. And then, last, I really want you to think about this, is when are you flowing with life, and when are you resisting it? We have to flow through life, flow through coronavirus, and just kind of keep moving. When we resist it, that's when we start to have those stressors just seem like uncontrollable, and life just kind of feels very out of whack. So, again, when are you flowing with life, and when are you resisting it? From here, though, we're going to go ahead and jump in with John, and he's going to talk about, again, that underrated topic of sleep.
Thank you, Savannah. That was fantastic. So, we're going to enter into topic 3 of 4 here. We've been talking about inflammation, as Dr. Galgan started off with that cytokine storm and inflammation throughout the body that we're seeing in viruses as well as the COVID-19. Reducing your inflammation and boosting your immune system is a very powerful tool, and hopefully you're starting to see that. So let's talk real quick about sleep. We're going to bring Savannah right back up for nutrition. So my name is John Fritz again. I'm a diabetes educator, certified diabetes educator, a clinical exercise physiologist in the manager here at the Heart of the Rockies Wellness Program. I want to talk a little bit about sleep, something that I love, sleep. And it's something I've done since I was 18, even in grade school. I always saw sleep as a really powerful tool in keeping me fresh and healthy. So adequate sleep is really important to the immune system. And what happens is when you sleep, your immune system releases cytokines. And remember, cytokines are really good until they get to be too much. But you have an appropriate release of cytokines, and cytokines need to increase when you have an infection or inflammation, remember. Sleep deprivation, that would be multiple days of sleep deprivation or chronic sleep deprivation, which is something we see. That is going to decrease production of cytokines. So a lack of sleep is very highly correlated to risk of infection. So let's look at sleep deprivation. I thought this is a really nice graphic to kind of highlight that you have sleep deprivation affects the immune system, and this is how. You have a reduced production of cytokines. There are many functions of cytokines, as we mentioned, and it's going to also increase your chance of illness, and that's obviously why we're here today. Increase your chance of illness. All right, and like Sam mentioned, is the severity of illness is also something we can have some control over. What is the optimal amount of sleep? I've got another slide here to highlight this, but for adults, between 7 and 9 hours is what we say. This slide comes from sleepeducation.org, which is a national organization associated with the American Academy of Sleep Medicine, and you can see adults should have 7 to 9. I've been sleeping 8 to 9 hours for 30 years. It's just it's a great thing, and I guess everyone has their own level, but statistically, from research, 7 to 9 is what is recommended. So if you are getting less, or you would like to have more, there's a lot of information that we can do to look at that. There's more than just 5 tips for better sleep, but here's a couple of big ones. Is screen time at night can really keep a lot of Americans awake. We're addicted to our phones, and I'm no different. I always feel so much better when when I can put down the phone or not watch TV and just sit outside, maybe go for a walk, see the stars. There's a lot of great things you can do. Make sure you have a nightly routine. Avoid caffeine, alcohol, eating too late. In fact, Savannah's going to talk about making sure you have a big window of time where you are not ingesting food. That's really good for your body. And try to sleep at the same time every night. There are a lot more tips, and there's a lot more you can do, like journaling, keeping a sleep journal, and relaxing music, this and that. But what's the most important is if you are not getting 7 to 9 hours of restful sleep, the kind of sleep that is producing and increasing cytokines, which obviously you don't know, but 7 to 9 hours of refreshing sleep, seek help. Medical professionals can help you. We can assess your sleep, but it's really important that you would go and seek help to have better sleep. And it's so important. In fact, so important that we're talking about it here today. I want to bring Savannah back up. Savannah is also highly educated in nutrition, and she's a functional medicine health coach. She has a strong understanding of anti-inflammatory foods, and she's going to discuss that. And after this, we'll have a chance for some questions, to answer questions. But Savannah, come back up and tell us about this nutrition, which everyone's eager to share.
Okay, so boosting our immune system and fighting inflammation with food. So a lot of the main topics today are fighting inflammation. And again, I want to start off with just like a little thing to think about, but like one of the most powerful tools to combat illness comes not from the pharmacy, but from the grocery store. We have a choice of what we put into our bodies every single day, and it's probably one of the most important choices we make every day. So let's get into it. So first off, why are we choosing an anti-inflammatory diet? Well, our immune system relies on nutrient-dense whole foods to function well. And many experimental studies have shown that components of foods and beverages may have anti-inflammatory effects. We'll talk about this later, but we all know that curcumin, turmeric, is really good for inflammation, right? We've all heard it. So there's a lot of foods that are very good for inflammation and fighting it. And the biggest thing is choosing the right anti-inflammatory foods can help you reduce your risk of illness. And then consistently picking the wrong foods can accelerate the inflammatory disease process. You know, think about asking yourself, would you ever put diesel in a car that doesn't take diesel? No. So why are we choosing foods that are not providing the correct fuel source? Another way to kind of picture this is what's going on in our bodies as we consume foods. When we're not exercising, we're not getting the right sleep, we're not handling our stress. So we've all had this happen. We cut an apple maybe a little too early before a party, or we cut it and leave it at rest sitting on the counter. And what happens when we come back? It turns brown. So this is called oxidation. Oxidation happens in our body, but we have a thing called oxidative stress. And that's like our aging process. What happens though is that as this oxidation process happens, our body starts to deteriorate, starts to age. And we can kind of control how fast it stops. So when we think about it, think of an apple kind of turning brown prematurely. That's kind of what's happening in our body with our food choices, whether they're a positive food choice or a negative one. To kind of get into it, we have some anti-inflammatory diet principles just to kind of follow. So we're going to kind of go through each one of these on their own, but they start with reducing your sugar and refined starch intake, ensuring we get adequate protein, filling your plate with vegetables and fruits, which we call antioxidants, consuming omega-3 fatty acids, adding fruits and spices, and avoiding trigger foods. So, reducing sugar and refined starch intake. I personally will say I have a horrible sweet tooth, so sometimes this can be kind of hard. But studies have shown that refined sugars can suppress your immune system for hours after ingesting. So maybe you're on your way to work and you're drinking a higher sugar coffee. Your immune system is already on the downturn when we want it to be working for us. So how can we do this? We can avoid and limit added sugars and refined carbohydrates. So that's our white bread, our